Morning, I am Marsa B. Pulga from BSN 2A, and for today I will be demonstrating and show how to set up an IV. And before anything else, before I finally start, I have to introduce the things that I'll be using for this procedure. Introduce the materials that I'll be using. So I have here my swab, alcohol swabs. I'll be using this to wipe if there's, and I also have here a syringe. Imagine that this syringe is for IV, and for the setup of IV, since I don't have a syringe. I also have here the tourniquet. um, Imagine that this is a tourniquet. And also I have here the micropore. Imagine that this is a micropore. Also I have here my gloves. For example, this is sterile gloves. And then I also have here the tube and the roller clamp sample. And also imagine that this is an IV bag solution. That's all. So uh, I'm done introducing the things that I'll be using. I will now proceed on hand washing. So let's go. There are many type of IV solution. The first one is the isotonic. It has zero point 0.9 normal saline and zero point 0.9 sodium chloride, and it used for fluid resuscitation for hemorrhaging, severe vomiting, diarrhea, gastrointestinal losses, wound drainage, mild hyponatremia or blood transfusion. Of course, the nursing consideration for this is to monitor closely for hypervolemia, especially with heart failure and renal failure. Another IV solution under isotonic, which is the lactated Ranger solution, or what we also called as LR. This fluid resuscitation, it is for GI tract fluid losses, burns, traumas, or metabolic acidosis, and it's often used for during surgery. And the nursing consideration for this is it should not be used if serum pH is greater than 7.5 because it will worsen alkalosis, and it may elevate potassium levels if used with renal failure. Still one example, IV solution of isotonic, but I will now proceed on hypotonic. This is a type of IV solution, and the IV solution for this is 0.5% sodium chloride and 0.45% sodium chloride also. It is used to treat intracellular dehydration and hypernatremia, and to provide fluid for renal excretion of solutes. The nursing consideration for this is to monitor closely for hypovolemia, hypotension, or confusion due to fluid shifting into the intracellular space, which can be life-threatening. Avoid use in patients with liver disease, trauma, and burns to prevent hypovolemia from worsening. And monitor closely for cerebral edema. So for hypotonic, which is the 5% dextrose in water, it is provides spray water promote renal excretion of solutes and treat hypernatremia, as well as some dextrose supplementation. The nurse consideration is to monitor closely for hypovolemia, hypotension, or confusion due to fluid shifting out of the intravascular space, which can be life-threatening, and avoid use in patient with liver disease also, trauma, burns to prevent hypovolemia from worsening also, and monitor closely for cerebral edema. Proceed on hypertonic, 3% of sodium chloride or NaCl. It is used to treat severe hyponatremia and cerebral edema, and the nurse should monitor closely for hypervolemia, hypernatremia, and associated respiratory distress. Do not use it with patient experiencing heart failure, renal failure, or conditions caused by cellular dehydration because it will worsen this condition. And also we have here 5% dextrose and 0.45% sodium chloride. It is used to treat severe hyponatremia and cerebral edema. Also monitor closely for hypervolemia, hypernatremia, and associated respiratory distress. Actually, the nursing consideration for hypertonic is all the same. So, we will now proceed on the sticking patient. Anything else, we have to verify the doctor's order indicating the types of solution, its amount to be administered, and the rate of the flow of the solution, and label it properly. And also, we have to compute for the rate and the flow of the next IV. And then we will now proceed. I will just close the door or the curtains. This is to provide privacy to the patient. So we can now move. Good morning, ma'am. I am Marisa Pulga, and I am your student nurse for today. So before starting, may I know your name? Okay, Miss Ma'am. For today, I'll be changing your IV fluid. Um, may I ask first if are you comfortable? Okay, thank you. IV fluids are especially permeated liquids that are injected into the vein to prevent or treat dehydration. They are explaining the procedure and the purpose of this to the client. I wash my hands and now I'm wearing my gloves. I will now start on cutting the um, micropore tape correctly. So I have here my micropore tape and I will cut it correctly and assertively. So I have here and I will just put it on sterile surface. I cut two pieces here, the second one. And then after that, we will open and prepare the infusion set. So I have here the tube. Excuse me. So this is imagine that this is the tube, and then this is the roller clamp. I was just I was just close the roller clamp tape. I will now proceed on preparing the infusion set so that I can already spike the IV solution. So I have here my infusion set. Imagine that this is the infusion set, and I already opened it, and I just prepare it already, and then So I will now remove it, the tube. I will now remove the tube from the IV solution bag. Now, I will now remove the tubing from the container and straighten it out. Also, close the roller clamp. Finally, removing the tube from the former IV solution bag, which is already ubos na yung fluid na naroon. I will now open the remove the protective cover of the new solution. So, imagine that this is the new solution and it's not, imagine that it's not still spiked. I have to do this already since it's that. So, I remove the protective cover of the solution. I will now hang it on the IV stand. Imagine that this is my IV stand. Change the IV solution. I will now spike the container. So imagine that it's not still spike. I mean, hindi pa na spike yung container. Okay, spike the solution container and maintain sterility and integrity of the spike. So, after spiking, hang the container since I already hung the solution container on the IV stand. Regulate the flow rate. Apply the IV label. Tag on the solution container with the client's name, type of solution, incorporation, amount to be administered, flow rate, time of administration, and if any signature. So I have here, I will now apply it. So partially fill the drip chamber with solution by squeezing the chamber gently, squeezing or pinching. Then prime the tubing slowly, remove the protective cap, and maintain the sterility of the other end of the tube and the cap. And release the clamp slowly. So here's the roller clamp. And let the fluid run through the tubing until the bubbles are removed. And then reclamp the tubing, replace the cap and appearance of the infusion site. Ensure that the correct type of fluid is being infused, and then the rate of flow. And the response of the client to the solution. And then always check the IV label, the tag which is contain the patient name, room number, IV to infuse, and drug incorporation, and if any duration, time and date, such as like that. And also observe flow every hour, and always observe the flow rate of a prescribed rate and time. And then inspect the patency of the IV tubing and the needle, and check for pinches, kinks, or obstruction to the flow. this. And if any, lower the solution container below the level of the client, or of the infusion site, and observe for the backflow. So, inspect the insertion site for complication like swelling, coolness, pallor, discomfort, or pain. Miss Ma'am, are you having discomfort or any pain? Are you feeling any pain? Okay, you're alright. Thank you. So we're done. I will now discard this to the trash bin where it's properly disposed. And then I will now document the date and the time you inserted the IV fluid, the gauge and the brand name or type and length of the catheter, the number of attempts needed to insert, and the solution, what solution or drug the patient is receiving. Proceed on discontinuing the IV solution. So first, we have to verify the doctor's order indicating discontinuance of the IV solution. Proceed on discontinuing the IV solution. So first, we have to verify the doctor's order indicating discontinuance of the IV solution. Um, Perform hand washing, and then after that, wear gloves, sterile gloves. Here, will now wear it. So, I wear my gloves, and I will now prepare all the needed materials, and then I will now proceed to my patient. Good morning, ma'am. I am Essa, and I am your student nurse for today. And the reasons to discontinue IV fluids are either the patient's fluid volume has returned to baseline, the patient is being discharged from the facility, the IV catheter needs to be replaced, or the IV site is becoming unfavorable due to infection infiltration. I already explained the procedure and its purpose to the patient. I will now start to remove the microphore tape one at a time, and it should be gently and accurate. So here, and then close the roller clamp. Apply pressure over the site while examining the catheter remove. And then withdraw the needle or catheter from the vein and cover the venipuncture site with a clean cotton ball. So, for example, this is the clean cotton ball. And then apply pressure over the site while examining the catheter remove. Assess the venipuncture site for any untoward complication like ecchymosis or pain. Do you feel any pain, ma'am? None. Okay, thank you. And then dispose the catheter, remove cautiously, especially the sharp one. So we have trash bin for this. So we'll now dispose it. So we're done. I will now discard this to the trash bin where it's properly disposed. And then I will now document. Okay, that's all. Thank you.